Hi, welcome to one of the most important topic, TNM classification of oral cavity. So first we are going to see T classification. In oral cavity we have a very unique entity called depth of invasion. So this is a new entity that has been introduced, added in 8th AJCC classification. So it is nothing but depth of invasion, right? So when the tumor size is less than 2 centimeter and depth of invasion is less than or equal to 5 mm, it comes under T1. Now, when the tumor is less than or equal to 2 centimeter and depth of invasion is 5 to 10 mm, it comes under T2. The other thing which can be classified as T2 is when the tumor is less than 4 centimeter, that is nothing but 2 to 4 centimeters, and depth of invasion is less than or equal to 1 centimeter. This can also be classified as T2. Okay, right. Then more than 4 centimeter tumor with more than 1 centimeter depth of invasion, this comes under T3. Now, moving to T4A. Basically oral cavity is something uh, that is in adjacent to the base of skull or the masticator space and all. Now, you can remember T4A easily with the help of adjacent anatomy. Let's say, for example, a patient has got lip cancer. Now, whenever this lip cancer is involving either the facial skin or if it is involving or infiltrating inferior alveolar nerve or the floor of oral cavity, this will come under T4A, which is nothing but moderately advanced disease. Let's say, for example, if the patient has got oral cavity lesion inside the oral cavity, now if this tumor goes and infiltrates or involves cortical bone of either maxilla or mandible, or it can be maxillary sinus or the facial skin, any of these structures involvement will be coming under T4A, right? So this is regarding oral cavity for T4A. Now, when it comes to T4B, when it comes to T4B, so it is nothing but again it's the very advanced disease. Masticator space is nothing but any of your masticator muscles. So it is nothing but, so one is your pterygoid muscles and temporalis muscle or masseter muscle. So any of these four important muscles of mastication, and where these pterygoid muscles are attached, there is nothing but pterygoid plates and skull base. When it goes and encases the internal carotid artery, so major vessel encasement. So this will also come under T4B, right? So this is most important regarding T classification of oral cavity cancer. Now let us look at nodal classification. So node involvement. So the first one is, you have N1, N2A, N2B, N2C, N3A, N3B. Now you can easily remember whenever you have single ipsilateral lymph node which is less than 3 centimeters, it comes under N1. Now, whenever you have single ipsilateral lymph node which is of 3 to 6 centimeter, it will come under N2A. Now, when there are multiple ipsilateral nodes, but all the nodes are less than 6 centimeter, nothing is beyond 6 centimeters. So, multiple ipsilateral lymph nodes not more than 6 centimeter will come under N2B. Okay, right. So, then whenever you are having bilateral or contralateral lymph nodes which are less than 6 centimeter, again up to 6 centimeter will come under either N1, N2A, N2B, N2C. So bilateral or contralateral lymph nodes which are again less than 6 centimeter will come under N2C. Now, whenever any node which is present which is more than 6 centimeter, no matter where it is, it will come under N3A. So whatever the number of lymph nodes wherever they are present, if it is more than 6 centimeter, it will come under N3A. Now, whenever you have got extranodal extension positive, so it will come under N3B. Okay. So you can easily remember, like you can go in a reverse order also. So when the report says extranodal extension present, N3B. What is the size of the lymph node involved? More than 6 centimeter, N3A. Less than 6 centimeter, whether they are bilateral or contralateral, N2C. Whether they are multiple ipsilateral, N2B. If it is 3 to 6 centimeter, single ipsilateral lymph node, N2A. Then if it is single ipsilateral node less than 3 centimeter, N1. Okay. So this is the important nodal classification for oral cavity cancer. Now let's briefly look at the staging. So you can easily remember stage 0, 1, 2, 3, 4, 5. So whenever you have metastasis present, 4C. So whenever you have got T4B with any N, what is T4B basically? What is T4B? So as you can see here, whenever there is invasion of masticator space or pterygoid plates or skull base and ICA encasement. So whenever you have got T4B, no matter what the nodal grading is, it will come under 4B. Or no matter what the T classification is, but if it is N3, it can be 3A, 3B, 3C. So if it is N3, again it will come under stage 4B. Now, first three are easy to remember. Obviously, T1 will come under stage 1, T2 will come under stage 2, T3 will come under stage 3. Also, if it is T1 or 2 or 3 with single ipsilateral node, which is less than or equal to 3 centimeters, that will come under stage 3 again. Okay. Now, whenever it is T4A, either the nodes are positive or negative, it will come under stage 4A. So, T4A with or without nodes will come under 4A, right? Then T1 to 3 or even 4A, but if it is N2, again it will come under stage 4A. All right. So I'll just repeat it. So whenever it is T1 stage 1, T2 stage 2, T3 stage 3. Also, what additionally comes under T3 means, I mean, stage 3 means you can have T1 or 2 or 3 with N1. That will also come under stage 3. Then, whenever it is T4A, whether the nodes are positive or not, it will come under stage 4A. Or if the nodes are present and if it is N2, that will also come under 4A. Then, if it is N2 along with the 4A, you can have T1 or 2 or 3. So this will come under stage 4A, right? Then if it is, no matter what the T classification is, if it is N3, again stage 4B. Whenever you have got, no matter what the nodal grading is, but if it is T4B, again stage 4B, right? So what are the most important modifications that have been added in 8th AGCC classification? So one is depth of invasion is added. Second one is external extension is N3B, and whenever you have got extrinsic muscle invasion, that is removed from T4. Okay, right. So this is regarding TNM classification of oral cavity. Thank you.